most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
we're going to show you how to instantly relieve back pain between the shoulder blades. We've got 3 easy options plus a bonus.
That's right, Bob. Bob, this is a great thing to do. I've shown this to patients, but these are my favorite 3 I personally do. And I'll tell you when I actually have used these in the past with great success.
And so have I.
Excellent.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, go to the giveaway section.
That's right.
We're always giving something away every week, but today is the one-day hiatus. Tomorrow we'll start again. I think we're giving away a mattress tomorrow, Brad.
Oh, really? So that'd be on a Sunday.
Yeah,
you'll find
Sunday,
that out. Yep.
So you can go to bobandbrad.com, like I said, or you can go to Facebook. It'll be pinned to the top of the page. The contest, go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
And now we have not iPod,
Podcast.
Podcast. I knew some kind of pod was in there. Anyways,
we'll talk about the iPod.
Yeah. Anyways, yeah, the podcasts are wonderful. We got some really good interviews, professionals, experts, the whole works. So anyways, between the shoulder blades, we're talking about the thoracic spine.
Yes.
And let's just show specifically where we're at there, Bob.
So here are the shoulder blades. Here's one. Here's the other. Right this area right here. Oh. Very common to get pain in this area, especially with what, Brad?
When you have poor posture.
Show for the side, Brad.
Yeah.
There we go. Especially you got a laptop and you're leaning down and looking at the screen, or your desktop and the screen's not high enough. And
right.
So
you get your head
or
down.
You got bifocals. There's just a lot of things that can.
Sometimes I had a vehicle once. I was driving my brother's truck. It's a terrible seat.
Yeah.
And I can't get good posture because it sucks me right down in there.
I have seen new vehicles like that. The headrest was so damn weird. I was so weird. I'm sorry.
It's a family show,
it's
Bob.
A family show. Sorry about
that. So the whole point is typically these pains are from posture, prolonged poor posture. And I've done this first one. I've got out of bed and I had this pain right there, and it kind of almost hurt when you take a deep breath. Mm-hmm. You could feel it. So this is what I did. I went downstairs because that's where I have my 6-inch roller, and put it down on the floor like this. And this started the whole thing. I've been doing this for years. Now I've got some better options we're going to show you, at least better for me.
Easier options, too.
And we roll like this, and almost always I'll get a little cavitation or a crack. And you have to learn how to relax while you do this. And right now I'm going to arch a little bit more. And there we go. Yes. So take your time with this. If you've never done it before, don't, you might keep your butt on the ground and work gently over this. And as you feel more comfortable with it, then you can get your butt up and learn how to relax and arch over it.
You know what some of the big guys do, actually, Brad?
What's that?
They actually put a kettlebell on top of them and put additional weight on
them. Sure, if they want more weight.
Right.
Yep. Yeah, if you feel like you don't have enough, go ahead and add some weight. You can also turn it this way.
Be careful,
Yeah. And this is it's not as aggressive. You can just lay here and let your shoulders relax. Get your head down and just relax for a few minutes. And sometimes, it's going to absolutely endorse good posture, promote it and help that pain. I usually do the roller one. This one, I was done.
If you're older and you have difficulty getting on a roll like this, they do have the half rollers, Brad. That OPTP sells this. It's by Sarah Meeks, and it's actually soft.
Yeah.
So you can lie on it real easy if you're more elderly.
Yeah, more tolerable for that. All right, number two, Bob, you can use a tennis ball. If you don't have a foam roller, you don't have to buy one. There's an option. We're going to use a red ball, but you can use a tennis ball. Typically is a good one to start with.
It is.
And you can do this 2 ways. You can start here on the wall. I'm going to put it between the shoulder blades on the muscle part, not on my spine. And I'm going to lean back into it. And I like to actually roll up and down. And you can work it. I'm going to work my right side of the spine go to the left side of the spine. To be honest with you, when I have that pain, this isn't aggressive enough
Sure.
for me. It's okay. It's a good way to start.
You can also put it in a sock to help
Right.
control where it's at.
You know, I was going to get our sock example, and then,
I
well,
forgot.
yeah. But that's okay because I think for a lot of people,
This
especially
is the one that's going to work better.
yeah, and you go on a carpeted floor, not on your bed, it won't work. And you put it on there, and you can just simply lie on it, put your body weight into it, and
If
work.
it's too aggressive for you to start, you might put a towel over the top of it.
Yeah,
It'll
exactly.
blunt it a little bit.
Yeah. And you can roll back and forth, and you'll typically feel the spot. There will be one area that needs it, and it's going to hurt a little bit more, but it should be one of those hurt so good. The longer you're on it, the better it feels. If it gets worse, then you're going to go around it and just work up one side and the other. Oh, thank you, Bob. Yeah. So
Now, if you find this works for you and you want to upgrade, you might try the back pod. We've had Steve on. He's the one that invented this thing. He works really well for costochondritis.
Steve who?
What is it?
Steve on. I thought it was August.
It is Steve August.
Oh,
I
okay.
said we've had Steve on.
Oh, you mean on a program. I get it. I'm a little slow.
So it's a little pricey, but I'll tell you, Brad and I love this thing. I'll tell you, and Brad's had Costo.
Yeah, this has
Chondritis.
taken care of my costochondritis, which is chest pain from your ribs.
Also known, also variant of that is TT syndrome.
Yeah,
So
but I do use this on a.
I
I even
use
took
this
it on
all the
vacation.
time. My wife uses this all the time. I've given it to about 10 friends so far.
But yeah, I would not go out and just buy one.
No, I wouldn't. Try the ball first,
Right.
and maybe that'll do it for you. But if you're serious about your posture or serious about your costo, this is the way to go.
Yeah, and he has actually. You can use it on your sacrum, and there's other parts that. The
Yeah,
author-
he's got a really great booklet that he sends along with it. The book might be worth the price of the device alone. It's really well
Right.
done.
We should do some more videos on some of the options with
Yeah,
that.
we should.
And we will. And finally, this is also one of my go-to exercises when I get pain here, as well as my shoulders. This is a good maintenance exercise thing that I do on a regular basis, is simply hanging. Go to a pull-up bar or anything solid you can grip and hang safely on that will hold your weight. I'm using these are designed specifically for this. Up against the wall, puts your back in really good posture. And we're just going to slowly, this is a critical part, Bob. Don't you agree? You have to slowly, when you
Right.
start, go down slowly, particularly if you're a little older.
Yes.
If you're 20 years old,
You can
you
jump.
might get away with more. And slide down slowly. And, I'll oftentimes do this and I'll feel crack, bopple, and,
Sure.
and things are feeling better. And I'll hang for up to 30 seconds. How about you?
Well, if
You
you're
do it like when you're in the middle of work, just to take a break.
Yes, I do.
Yep.
I spread it out, and my back always cracks or cavitates, which tells me that I had been compressing it for a while, and this helps
Yeah.
extend it out. But it's funny, if you live in the cities, there's always construction going on, so you just walk by some scaffolding, go to scaffolding, hang on the scaffolding.
Yeah, hang on to scaffolding
the bars
until
and-
they kick you out.
And if you're in the city, most of the people are weird there anyways sometimes, so
Yeah, you fit right in.
you fit right in.
I
So.
do want to mention, Bob, I was reading one of the comments, or a couple comments, and people, we were doing hanging on another one for, I can't remember what it was for, but they said, oh, I've got rotator cuff problems. I can't hang. It'll hurt too much.
Yeah.
But if you look up some videos we have on rotator cuff injuries and hanging, there is a surgeon, a shoulder surgeon, who wrote a book on hanging. His name is
Dr. Kirsch.
Dr. Kirsch. And
that
actually, you can use a specific treatment for shoulder problems,
Yes.
and particularly impingement problems.
In fact, that's what the book is about.
Right.
I mean, he mentions back, but really it's mostly about shoulder. And
Right.
he's got testimonials that you wouldn't believe. I
Sure.
mean, there's people that are like saying they were headed for rotator cuff surgery, and they actually ended
Right.
up not having the surgery, and they got full motion and strength. And
I know we're getting on a
Yeah.
tangent here, but I just want to mention, because we can't say enough about hanging as a
Hanging.
treatment.
Yeah.
Now,
Brachiating.
brachiating. There you
Yeah.
go. We do want to give the bonus because we did
Oh,
mention
yeah,
the
that's
bonus.
right.
Yes, this is one you can easily do at work or at home. You need a chair that's got a backrest, and maybe you're at work and you're slouched and you start feel that between the shoulder blade pain, and you want to continue to work. So you're just going to take a mini break. Take a ball that's soft and squishy, not a like a basketball. That would be way too hard. Something squishy. Put it in between the shoulder blades, and you're simply gonna arch your back over it.
Or bring your arms up.
Yep. Bob's favorite.
Hallelujah.
Hallelujah. The back is feeling better already. And even if your shoulders, if you don't have that pain there, it's a really good maintenance stretch to do. So everyone at their workstation, if you work at a computer all day long, should have your back ball.
Well, all you have to do, Brad, is you go play a game of dodgeball with kids.
Yep.
And right as you're about ready to throw it, you just run out the door with it and keep it. Because-
Well, they'll get another one from
Yeah, that's
someone.
right.
Or, you can buy them one for Christmas, but at least you got one until
they
then.
might cry a little bit, but it
Bob,
builds
it's a
character.
family show.
It builds character.
We're
So-
just having fun now. So
all
good
right
luck
then.
with that pain between the back and the shoulder blades. One of these will be helpful for sure.
All right, peace.